Hello, my name is Bianca Agby. Today I'm going to be conducting a musculoskeletal assessment here on my patient. So before I begin, I'm just going to introduce myself. Hello, my name is Bianca. I'm a nursing student at Perryview, and today I'm going to be conducting a musculoskeletal assessment on you. Is that okay?
Yes.
Okay, so I'm just going to perform my hand hygiene. So before we begin, I'm going to need to ask you a couple of questions. First question, have you experienced any abnormal weight gain?
No.
Okay, so do you have any pain or tenderness on your joints or muscles?
No.
Okay, now are you a smoker?
No.
Okay, do you have a family history of osteoporosis or rheumatoid arthritis?
No.
Okay, so my questions are done. So the first thing I'm going to be doing, I'm going to be inspecting and palpating your TMJ. So right here. Go ahead and clench your teeth for me. Open and close your mouth. Open, close your mouth again. Okay. Go ahead and move your jaw side to side. Do you feel any pain or tenderness?
No.
Okay, so no pain or tenderness were noted on the TMJ joint. So my client has full range of motion on the TMJ, and he can open and close his mouth with resistance. So next thing I'm going to be doing, I'm going to be inspecting and palpating your spine. So if you can just go ahead to turn around for me. Go ahead, bend over and touch your toes. Okay. Do you feel any pain or tenderness?
No.
Okay, so my client's spine is straight. There's no pain or tenderness noted. So go ahead, turn around. The next thing I'm going to be checking for is your cervical spine. So if you can just rotate your neck front and back. Okay, now side to side. Look to the left for me. Look to the right. And then do a full rotation of your neck. Did you feel any pain or tenderness while doing those exercises?
No.
Okay, so my client has full range of motion of his cervical spine. No pain or tenderness is noted. So the next thing I'm going to be doing is testing your range of motion of your thoracic and your lumbar spine. So go ahead and turn around for me again. Bend over and touch your toes. Okay, come up. Now lean to the left for me. Okay, you can come up. Lean to the right for me. Come up. And you can look towards me now. Go ahead and rotate at the waist. To the left. And then now to the right. Okay, so my client has full range of motion of his thoracic and lumbar spine. Did you feel any pain or tenderness while doing those exercises?
No.
Okay, thank you. So the next thing I'm going to be doing, I'm going to be inspecting, I'm going to be inspecting all of your joints, starting with the TMJ. Any pain or tenderness?
No.
Okay, so now your sternoclavicular joint. Any pain or tenderness?
No.
Shoulder. Let me know if you feel any pain. Your elbows. Okay, your wrists. Now your metacarpals. Okay, now I'm going to be palpating and inspecting your hip joint. Any pain or tenderness?
No.
Okay. Now I'm going down towards your knees. I'm at the ankles now. And then the toes. Did you feel any pain or tenderness throughout the palpation?
No.
Okay, so my client is not experiencing any pain or tenderness at his joints. I didn't see any signs of edema or inflammation. His skin color is consistent throughout, and there are no signs of redness. So now I'm gonna be testing your shoulder range of motion. So if you can just pull your hands forward and back. Okay, now if you can just bring both of your hands over your head. Okay, relax. Put both of your hands over your head, like this. Relax, behind your back. Okay, go ahead and shrug your shoulders. Go ahead and rotate your shoulders. Did you feel any pain or tenderness throughout the exercise?
No.
Okay, so my client has full range of motion on his shoulders. There's no pain or tenderness throughout the assessment. So that concludes my musculoskeletal assessment. Do you have any questions for me?
No, I don't.
Okay, thank you.
Be performing the musculoskeletal assessment on you. While you identify your name and date of birth for me, I'm gonna perform my hand hygiene. So today I'm gonna start with by testing the test of room of your elbows and hands and fingers, and I'm gonna be testing for any signs of edema, consistency, color, and any tenderness, and I'm gonna be palpating too. Tell me if you feel any tenderness while I do that. So while I work my way down to your elbows and your hands, I'm gonna be going down to your wrist, and I want you to tell me if you feel any pain or tenderness. I want you to fix your hand flat and turn it inwardly and outwardly, and with your fist too. No signs of okay. All right, so now I'm gonna be doing the Tinel test. The Tinel test, I want to check for any median nerves or any irritation in your median nerves. Is there any signs of burning or tingling while I'm doing this? So I'm gonna be percussing it. So the next thing I'm gonna do is the Fresnel test. So the Fresnel test, I'm gonna ask you to put both hands back to back while flexing your wrist with a 90-degree, and tell me if you feel any numbness or burning while you do that. Okay, so so there's no burning or tingling in your hands, that which is good, and you it's a negative of Fresnel test. Okay, so I'm gonna be doing the grip strength. I'm gonna place my hand in your palm, and I want you to grip it while grip it as much as you can. Okay, so patience grips strong bilaterally. So now I'm gonna do the roam of your hips, and I'm gonna put you in a supine position, and I want you to tell me if you feel any pain while I do that, and while I work my way down to your knees and ankle. I'm gonna bend your feet towards your chest. I'm gonna do the right side first, and I'm gonna go this way too, and to the right side. Any pain or tenderness? Okay, so I'm flexing your knee to your hip in a 90-degree. I'm gonna swing laterally and medially. Okay, tell me if you feel any pain. No? Okay. Also, I'm gonna do the left leg the same way. Okay, so the next thing I'm gonna do, I'm gonna go down to your knees and ankles, and I'm gonna be checking for any signs of edema. I'm gonna start with your right foot, and tell me if you feel any pain. Skin is consistent, and I'm gonna work my way down to your feet. I'm gonna check every of your feet, of your toe feet, and they are roaming as bilateral, and there's no sign of pain. Is there any pain in your feet? Okay, so I'm gonna do the left leg, the same thing. No sign of edema, any tenderness. No, skin is consistent with ethnicity. And I'm gonna bend it, and I'm gonna do the same thing to your toe feet in your left leg. Same thing. Okay, and that's it for me. Thank you.